from Vietnam, and today is our honor to be here to share with you guys about what we are doing in Vietnam. So about our project is about improving maternal and child health for the ethnic minority women. In this project, firstly, I would like to talk about some context of Vietnam. Even Vietnam get a huge progress to get the millennium sustainable goal about the maternal and child health, but we can see that they have a huge gap between the minority. The king, this is one of the main minority in Vietnam and is the other ethnic minority. So you can see in some table here, it gives some like indicator about the maternal mortality and also the under 5 mortality rate. So there is a huge difference between the king and also the minority. And also some barriers we find that it is about the geographical difficulty, the distance and education, and also sometimes language to access to the maternal and child health is also a big problems. The other thing is that the maternal and child health communication in Vietnam normally is a kind of traditional when we just only use the paper and also the radio communication to them, and sometimes this types of communication is not really effective. The women maybe they forgot and also they could not come to visit the community health center to get the information. And there's the mMOM solution here. We hope to is using the mHealth model, which is improved to provide the maternal and child health to the women in the mountainous area. And this model also being integrated with the local health management information system. So in this project, we focus on 4 main activities. Firstly, is we try to develop and pilot a maternal and child health information center, which is included the SMS, software, hardware, and also we provide the information to the women via the SMS. The second one, we try to feasibility study to learn about the context, the uptake and impact of the pilot intervention. It includes the ethnographic fieldwork, M&E midterm evaluation, final evaluation, and also the pre and post survey. Next one is the policy advocacy for the adoption and scale up for mHealth. So in this project, we are very lucky because the Thai Nguyen Health Department is also the key partner. They help us to conduct their project in their province. Also, the last main activity is the capacity building. We conduct training about the maternal and child health for the local health staff, and also the follow-up training. We make sure that they follow the step and also the quality of their consultation. Today in this conference, I always want to focus on how the maternal and child health information center work and also its impact. As you can see, I have a map here. The first one, you can see the first Thai Nguyen Health Department, they also have existing health information system. And in this project, our model, we developed a maternal and child health information center. This model will connect with the SMIS of Thai Nguyen to the unique identification code. And in this model, we would provide the 3 packets of healthcare. First one is first packet is for the newlyweds, and the second one for the prenatal care, and the last one is for the newborn, is the new mother. To make this model working, we have the community health staff. They mainly have the responsibility to register the woman into the system. And here you can see the target population. From about how the model work, basically, the system, they also send one-way information or reminding SMS to the women. The second one is the system send the interacting SMS to them. For the interactive SMS, maybe some people want to ask about that. I can explain here. It's like a question. The system send a question to them. Whether like do we have like a ANC checkup this month? So the woman needs to answer that. If the question is negative, so it means that this woman might have some problem. So the health staff can contact to them directly. It's the interaction between the community health staff and the woman. So I can some debrief that this model has some feature is now it's owned by the Thai Nguyen Health local Thai Nguyen Health department. So they manage the health system now, and they can follow up what happened with the system. And this one, the second one is this model is run by the community health staff. They mostly invite the women and register them into the system. And so that is all. And once the woman they already registered into the system automatically send the information to the woman. And that's one. This system is also integrated at the part of the HeartMix SMIS, mean Health Information System. I think that is some strong update model to help to improve not only the knowledge of the woman, it also helps them to train their behaviors. So let's see what the impact of this model. So we have some findings from the pre and post intervention and also the qualitative assessment. Firstly, we can see that the knowledge of the woman about the maternal and child health improves. If you guys can see the picture here, it's like compare the difference between the control commune, so which means that that commune did not receive the intervention and the intervention commune. We compare the different trends between them. The darker one is when the people start intervention, and the lighter is the indicator when they finish intervention. So the red line, it means that's the difference. The trend in the intervention commune is higher than in the control commune, and also that's behavior also change, and it was just thanks to this the health outcome also improve. So a key point here we could see that during this intervention, the interaction between the pregnant woman and new mother with the local health staff also improve. As it is very important because with the ethnic minority women, sometimes they shy to ask support from the local health staff, and this model also help to improve this. And here, so I have some through the. It's another slide about the proportion, the woman using the supplement during the pregnancy. And so during the final evaluation, we can see that it is some comment from the health staff and also the participant women. The participant, they indicate that their knowledge also have been trained, improved in comparison between the first child and the second child. And for the health staff, they also share that the woman asking more questions for them, it means that the process of interaction is really, really good for the both health staff and also the woman.